Welcome to our 5 on 5. We're pleased to be joined today by Kristin Parrish, a suicide prevention coordinator with Jackson County Mental Health. Kristin, thanks for being here.
Hi, yeah, thanks.
All right, so we're talking about suicide, of course. Tell us about what we're seeing locally in that respect.
Yeah, I think that a lot of people understand that we have higher rates here, but nobody really understands kind of what that really looks like. And so we're kind of here to talk about that today. So nationally, we lose about over 44,000 people in all of the United States.
Sure.
And then when we look at Jackson County, on average, we lose almost 50 people per year to suicide.
Wow.
Yeah, it's pretty shocking.
Okay, what kind of, obviously we want to stop that, slow that down at the very least. What kind of signs and symptoms should people be looking for with their loved ones, their friends?
Yeah, so we have a lot of different things and resources for people that they can look at American Foundation for Suicide Prevention. And so a lot of the different things that we want to pay attention to are behaviors, significant behavior changes. If they have been diagnosed with a mental health disorder, specifically depression, bipolar, and schizophrenia, those are pretty common for people to be thinking about suicide. But then also it does affect people from every socioeconomic status, not just, and ages too. So that's another thing to kind of look into. But talking about suicide are our main symptoms and signs that we really want to pay attention to. Mentioning like being in incredible emotional pain, those types of things.
Okay, and I know teenagers are as you said, all ages this happens, but teenagers may be one of the higher rates. I'm not sure about that, but it just seems like we're seeing, maybe is that on the rise right now?
Yeah, last year, 1/5 of the suicides that were here in Jackson County were youth. So when we say youth, that means 24 and under.
Okay.
So it was about 12 youth.
Wow, sorry to hear that. Okay,
Yeah.
so it's a difficult thing for people to talk about, but it is important that we talk about it.
Yes, very
How do we
important.
begin a conversation with a loved one, with someone we know about this?
I think that that's a really important thing that people are scared to talk about. The stigma around mental health, around suicide and saying the word is really worrisome. And sometimes people, it's so taboo that they've never said the word. And so I think that that's the most important thing we need to talk about is the idea of if you're worried about somebody to the point that, hey, in your mind, you might think that they might be thinking about suicide because of these behaviors changes, symptoms, those things that you're seeing. It's important to just ask the question directly. And even saying the words, are you thinking about suicide? That's completely acceptable. And there's a myth around asking about suicide that you're going to put it in someone's head.
Okay.
And that's not the case. There's research that shows over and over that that's not really the case. If you ask somebody directly about suicide, they're really going to be more likely to tell you, yeah, I actually am, and I've been feeling really down. They're going to feel more validated and say, wow, this person really does care, because instead of skirting around it and not addressing that, they're really caring enough to ask.
Wow, okay.
Yeah.
All right, well, that's good to know. There's no harm in asking.
Yeah, no harm.
Okay. All right, we're going to take a quick break.
Okay.
Not much more in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Kristin Parrish, a suicide prevention coordinator with Jackson County Mental Health. So we're talking before about the importance of asking the question. It's never a bad idea to talk to someone about suicide, or about maybe any negative thoughts they're having. What about resources for people to maybe better approach that situation?
Yeah, here in Jackson County, we have a local resource, Jackson County Mental Health, where I work. We have a crisis department that's open 24/7, and that number is 541-774-8201. So anyone could call that. It doesn't matter what insurance you have, whether you have no insurance, if you're from out of the area. If you're here in Jackson County, we can help you. Okay,
and is there training opportunities as well for people?
Yeah, so we do, that's a big part of my job is I do suicide prevention trainings, and that's, we train teachers, students, community members, child welfare, pretty much anyone who's willing to learn more about prevention.
Excellent. Okay, and I know NBC5 is very proud to be partnering as part of a coalition in putting an end to this and slowing this down here locally. What can you tell us about that partnership?
Yeah, so everyone here is going to be trained in one way or another. So we have a QPR training, which stands for Question, Persuade, Refer. So that's going to be the one that everyone here is going to be trained in.
Excellent. Well, we're very happy to be a part of it and putting an end to this.
Yeah.
We appreciate it. Thank you so much.
Thanks.
All right. Stay with us. We'll be right back.